Good afternoon, everyone. I hope you guys are having a wonderful day thus far. My name is Addison Davis. I currently am a second year health administration student at the College of Public Health, and I'll be graduating in May. And I also have along with me Shelby Wilson, who will now introduce herself.
So I'm Shelby Wilson, like she said, and I am a foundation year Master's of Social Work student, and I will be graduating in May of 2023.
We also have the visionary of the project, Dr. Joanne Skaggs, here with us today that's now going to talk about our situation at hand and some of the background pertaining to the initiative we're speaking on today.
So sepsis is the leading cause for hospital readmission at OU Health. When we've done a deep dive analysis, we've actually found that the drivers for the readmission are typically social determinants of health and a lack of understanding of their discharge plan. Currently, staffing limitations have really complicated the ability for us to get in while they're inpatient and screen them for social determinants of health. And then there's been very little aggressive patient discharge education. The lack of identifying patient barriers in discharge education does lead to an increased amount of sepsis readmission. So we started with the faculty think tank, and a shout out to all of those faculty. They're numerous, and we appreciate them so much. And out of that, we developed this student-led initiative to really create a new novel curriculum that nationally is something that is very novel. And so the components of that fall into identifying patients' social determinants of health and providing proper individualized discharge education within the scope of these barriers requires an integrated interprofessional approach. Although interprofessional education is emphasized within student learning objectives, formal and clinical interprofessional experiences are scarce, particularly on the inpatient side. Exposure to social determinants of health and how to provide effective healthcare within their limitations is an identifiable void within the health professional students' curriculum. The health professional curriculum includes counseling patients on health maintenance and disease prevention, but there is a lack of protected opportunities to complete this objective.
So now, as Dr. Skaggs has talked to you a little bit about the gaps we've identified and just some opportunities at hand, we want to talk about how we've operationalized this in collaboration with nursing, really leading the way to teach us how to really approach this gap in healthcare and on our inpatient side and in student curriculum for our health professional students. So we would receive the admissions report daily when we had a clinical experience at the hospital. And essentially, we would go through and pick out which patients we would look to service that day with this new and novel approach. We would have Dr. Skaggs or myself go up and just kind of touch base with the patient and make sure that, they were in a comfortable enough situation that we could talk to them and provide them some discharge education or planning, because we really wanted to get to them as their first admission to prevent them from readmitting in the future. So trying to work proactively here. So how that really worked out is that after we touched base with the patients to ensure that they were comfortable, we had students come to the hospital and really work with nursing leadership, and particularly Melissa Kraft, to really assemble this interprofessional education team consisting of nursing and social work for the beginning stages of this pilot. So upon arrival, they would get situated, introduce themselves to one another. I think that's a really big component of an interprofessional education, as we're doing these clinical experiences, we need to ensure that they are aware of the tools in their toolbox. And I consider those other tools are other professions that surround us daily that we need to utilize in healthcare. And we would talk about just general expectations and duties for the day. And then we would go into a chart biopsy of which patients we were looking at providing some discharge education too. Nursing and social work would then go into the patient room and conduct a social determinants of health screen and a health literacy screening to determine where the patient currently lied. The rest of the team would watch via Zoom just to ensure that they didn't miss out on any tidbits of information. We wanted to limit the number of people in the actual patient room at a time due to just ensuring that our patient was our primary focus and that their comfortable was assured. So after those screenings, nursing and social work would return to the team room and just debrief on what they found, and then really work to prepare some educational materials that have been vetted by our compliance board at OU Health, such as and formulated by our faculty think tank, as Dr. Joanne Skaggs was saying, about our healthy support planner and our discharge checklist. So those are two really critical pieces that help the patient kind of anticipate what's to come. And we will compile those along with any other resources that we had. And Shelby's going to talk about her experience as a social work student and helping the team compile those resources in just a moment. And then whichever profession had faculty oversight for that day, whether it was nursing or social work, we would have them go up to the floor and really provide education at the bedside and ensure that the patient didn't have any questions or comments or concerns, and that their self-efficacy after we left that room was off the charts and that they were able to transition home in a safe and proper manner. So from this assessment, we really wanted to formulate the student-led interprofessional education experience to accomplish really two goals: to reduce the readmissions of sepsis at OU Health and to also improve patient outcomes and in general, but also the ability for their health literacy to improve as well. On the flip side of this was really an opportunity to practice interprofessional education in the real world setting and really navigating these patients' social determinants of health that some students may not have the experience with thus far in their curriculum currently. And then we also wanted to focus on disease prevention. So what is your disease and how do you prevent it or get better? And that current health maintenance after they get out of the hospital. And then focus on effective use of healthcare. So identifying the need for a primary care physician versus an urgent care versus when to go to the emergency department as well.
So for interprofessional education learning objectives addressed, we have three key areas. And so for the first one, it is roles and responsibilities. So use the knowledge of one's own role and those of other professionals to appropriately assess and address the healthcare needs of patients and to promote as well as advance the health of populations. Second, interprofessional communication. So communicate with families, patients, communities, and professionals in health and other fields in a responsive and responsible manner that supports a team approach to the promotion and maintenance of health and the prevention and treatment of disease. And third, teams and teamwork. So apply relationship building values and the principles of team dynamics to perform efficiently in different team roles to plan, deliver, evaluate patient/population-centered care and population health programs and policies that are safe, timely, efficient, effective, and equitable. And from a student perspective, working on the project, working with an interprofessional team like this has helped me to kind of better understand the different roles of each team member that I didn't necessarily understand before and how they each contribute to patient care. It's also been beneficial to see how communication gaps in patient care can be filled by working with a team like this and being able to understand the various barriers that affect a patient's health. So the work to date on this project, so we've had 2 simulations and 2 in-person clinical events at OU Medical Center. And for the professions represented, we have 1 for nutrition, 2 social work, 6 nursing, 1 for occupational therapy, and 5 for medicine. And so far, we've serviced 3 patients and have been able to identify specific patient needs and provide resources that will hopefully reduce their chances of readmission.
So, as we've told you a little bit about this project, we also want to tell you where we're headed in the future. So, we're continuing planning for fall of 22 and spring of 23, really hoping to increase the number of programs represented on our HSC campus and really scale that to meet all the patients' needs. And then we'll continue to evaluate and tailor this program to ensure that it's really honing in on and addressing those gaps in social determinants of health and health literacy curriculum. We're also looking to increase our patient service, so the volume that we're seeing of patients, and then ensuring that we're relaying any success metrics for students' learning outcomes, as well as our patient outcomes as well. And then we're hoping to track these educated patients' readmission rates to determine if they're doing better with their readmission compared to the control group that did not receive this education. So now we are just open to discussion and would love to address any comments, questions, or concerns that you have.
And a shout out to Dr. Melissa Kraft and Traci Bartley for all that they've done to assist with this past semester.